So maybe if I could ask you to come to the table, Paul, Teresa, Virgil, Antonio. Y lo que os voy a animar es a que hagáis preguntas, porque a lo mejor, como hemos estado hablando en inglés, puede haber gente que se puede haber sentido un poquitín intimidada. Hay traducción simultánea y aprovechar, porque es el momento para preguntar aquellas cosas que queráis saber. Lo que iba a decir, a lo mejor, maybe do you want just to mention hematological problem?
What I can say is that on my I'm not a hematologist, but I had a full check of hematological findings in children with Jacobsen. Some of them have platelets, low platelets, with abnormality. Some have low normal platelets with abnormality, but this is when they grow up. Some children have the whole lot of blood cell reduced in number. So they have anemia, low white blood cells, and low platelets. I don't know if they are subgroups, and maybe Virgil studies will find out also this, because if the abnormality is in early cells, may affect also red blood cells. In bone marrow, in our patients, we saw small megakaryocytes. They were small, and they were thought to have abnormality in the development of blood cells. They were sent for what is the name? Fanconi's anemia, and this was differential diagnosis in some patients. With regard to the vaccination, I would like to say something. We usually tell children that they can have vaccination unless it's done with alive viruses, because this is dangerous. But I thought maybe they are not so effective because the children do not produce antibodies or produce little antibodies. So what is the strategy? I would ask Virgil.
Yes, that is an important remark. As already discussed also by you in this patient, that there was no response, adequate response to vaccination. In our studies in Rotterdam, we did the 6 Dutch patients, and we did vaccination testing. So what we do actually is we vaccinate a child, we measure antibodies prior to vaccination and after vaccination. And a normal response, you see an increase in the antibodies, because a vaccination should protect you against this bacterial infection. And what we saw in 5 out of 6 patients is that before vaccination and 6 weeks after vaccination, there was no response. So no protective response against vaccination.
Do you think it's still worth trying? I mean, 1 out of 6 responded.
Yes. What we saw in these 6 patients, that there were no negative reactions. So the vaccination was safe, but ineffective.
Yes.
Do you think there's any dependence on age in terms of the ability to respond to vaccine?
Doesn't know.
No. It was in both the young children, but also in the adult patients. So I would say you can vaccinate,
But don't expect her.
but you have to measure response.
Yes. And one thing I want to add is that at the first conference in San Diego, I thought there may be an immunodefect. And I took samples to Italy, and we did cell immune control and immunoglobulin control. And everything was normal. And I thought it was impossible, but I asked Virgil, the blood must be fresh. That's why our results were negative. Our results were normal because the blood was not so fresh. I traveled for 48 hours to go back home.
Can I just make one more comment about the bleeding? Our recommendation is that even if your child or adult has a normal platelet count, you should assume that they still have abnormal platelet function. And even today, we don't have a good test to prove if there is abnormal platelet function. And so I have worked with some of the hematologists that I know to come up with what we call a bleeding protocol. And this is a set of guidelines that you can get on the internet on the 11Q website. And you can present this to your treating doctors, ideally in advance, before there's any problem, so that if your child ever has a problem with bleeding, or, for example, might be having a procedure that puts them at risk for bleeding, then your treating doctors will have this information to protect your child. And I've actually, in the United States, worked with an attorney who has expertise in these protocols. And at least in the United States, if you give this to your treating physician, they are legally obligated to follow these guidelines to protect your child. And if they don't follow the guidelines, they could actually lose their medical license. And similarly, I'm hoping that Virgil and his colleague, Dr. Paris, in the United States, at the risk of his getting mad at me, can write up a similar protocol for the issues for the immune system.
So the question, Virgil, how would you protect these children? I mean, you can check, whether there's a response to vaccination, but, just rely on herd immunity, or just give them immunoglobulins if there's an epidemic of a specific, measles or whatever?
Well, yeah, there are still some questions to be answered. Because what we test right now is a certain vaccine, which which is solely depending on the B cells, I would say. So in some cases you could use another vaccine that could prevent for infections. We should further evaluate whether this is a problem in Jacobsen. That's one. So maybe you could try other vaccines, or you should go to indeed immunoglobulin depletion. Yeah. But that's something we have to find out in the near future. Yeah.
Okay. Sí, ¿alguna pregunta?
Gracias. Yo quería hacer una pregunta sobre el tema inmunológico. Nosotros lo que presenta mi sobrino es unos niveles muy bajos de inmunoglobulina M. No sé si eso se ha localizado en otros niños. Y luego también niveles muy bajos de neutrófilos.
Is there a question to me?
I think so.
Yes, I think so.
I missed the last part. So IgM is low.
Neutrophils.
And neutrophils.
Sorry?
And
Yes.
And neutrophils are low. With regard to the IgM, it's one of the most difficult questions to answer. Because if you go out on the street and you will measure IgM in the whole population, it will be low in quite a number of healthy people. So it's still difficult to make a conclusion that this low IgM is really a clinical significant problem. So that's one. The other, the low number of neutrophils, is something I didn't see in our patients, but as already discussed by Paul as well, is that the genes involved, maybe genes that are involved in all kind of other cell lines, so deletions in certain genes may lead to problems in various cell lines.
What about anemia? What about red blood cells?
¿Ha tenido anemia?
En principio no hay problemas. No ha respondido a la vacuna del tétanos, no presenta protección y tiene infecciones de repetición, sobre todo bronquitis, bronconeumonía y herpes simple.
Yeah, so this sounds like a true immunodeficiency,
Yes.
I would say. If we look in general to patients with low neutrophils, in general they suffer from recurrent skin infections, abscess from the skin, exactly, mucosal infections, and pulmonary infections.
Yo tengo una pregunta para Virgil. I will repeat it in English if you want. Que es en casos de inmunodeficiencia más importante, como este. I will translate that in English. En casos de inmunodeficiencia más importante, como una inmunodeficiencia celular, ¿hay alguna experiencia con trasplante de médula ósea? Is there any experience in the transplant of hematopoietic progenitors in this child with extreme, like the boy that has already been told, in Jacobsen patients, or not that you know?
No, there are no. There's no experience. There is no experience with stem cell transplantation in Jacobsen syndrome. We have very recent experience with bone marrow transplants in patients with comparable immunodeficiencies.
Right.
So those are patients with the same findings as in Jacobsen, but without Jacobsen. And those results were very, very, very disappointing. It was presented last week in another conference that 50% of those patients died during the procedure.
That's huge.
So it was really very disappointing. Yeah.
Sí. ¿Alguna otra pregunta? No sé si la madre Belén antes tenía un... ¿No? ¿Ha levantado la mano? No sé si...
I have two questions to all of you. The first one is, in our case, our daughter does not show any heart abnormality, bleeding, immunological affection of whatever. And I can tell you, we've got a huge medical history of her. Should we expect further complications, further abnormalities from every angle that we should prevent with regular tests or whatever? And the second one is, from your experience, did you find any regression in whatever patient you've got in his or her evolution?
I'll answer the first question. Maybe Teresa can answer the second question. As we talked about before, the first thing I would like to know is the size of your child's deletion
7, I think.
and where it is.
6, whatever.
So hers, boy or girl? Girl? So her deletion is very small and probably does not involve the genes that cause some of these major problems.
Sorry, she has a duplication of 10q.
Yeah, so she has an unbalanced.
Different.
So one of you is probably a carrier. But,
Yeah, it's me.
so based on what you're telling me about her 11q deletion, she might have some cognitive problems. She might have some behavioral problems. But I would not expect her to have the heart or bleeding problems.
No.
Am I right? So far?
Absolutely.
Anyway, I would like to see the breakpoint
Yeah.
before I can say if
For
you
sure.
are. You don't have to expect anything.
What I mean is that is it possible to find out that in a couple of years from now she shows some heart abnormalities or bleeding or whatever, even though...
If you tell me the breakpoint, I can tell you
Yes,
if...
34,
No,
But that's not helpful. The 6 megabase suggests, again, that
Yes,
these
but
genes are
I
not
want
involved.
to see the numbers
Yeah.
of the arrays, and then I can tell you. Okay.
So, and la otra pregunta era if you
wanna
have
answer
seen
that about
regression.
of the brain.
Regression,
Yeah.
disappearing features, bad features.
In development, no?
The number of platelets improves.
The opposite, behavioral... from
worse, people who get worse. Regression in the... in the yes, there are some heart problems that may be worsening or appearing with time. And I would say not only heart, but also blood vessels. I saw in the legs, but we don't have a checkup of this patient. I think we should check blood vessels. I do in my patients a full checkup of vessels every 2 years.
I think one other very important question that you raise is what about the brain over time? I think we don't know any answers. It's possible, based on a very recent paper,
Yes.
that there might be a small subset of patients who may have regression of brain function over time. But we don't really know, and only through studies like what Dr. Matina and he has done, that's the only way we can learn what happens over time.
I would like to stress how important it is to have MRIs. In young children, anesthesia is needed, and therefore the pediatrician may choose to postpone MRIs. But if it's necessary because of clinical findings, or if the children would go through MRI without anesthesia, it would be nice to have at least two. One at a certain point, and then another one after a couple of years to see what happens. And problems, progressive problems in the brain may be due to something we don't know, may be due to hemorrhages. And so if we have MRIs in a steady state, we may see what happens afterwards. I would like to stress again the need to collect the surgery files. And if we pull this information, we can tell you what is advisable in the case of a surgery, what the results would be if you may. Sometimes you have a relapse of the problems after surgery. If you have strabismus, and you may have intervention, and then the strabismus comes again. You may have problems with healing, or you may not. But if we have all the files from all the surgeries we can pull this information and give back to you and to your doctors when they have to go through interventions. And one thing I would like to ask to the researchers is, when you do a knockout mouse, send me a face photo and hands photo, but not like that, but like that.
I sent you those.
Yes, you sent me like that.
I'm waiting for results.
No,
Did you look at the pictures?
You sent me
Sí.
like that. I don't see.
It's hard to tell a mouse to put their hands down.
You do like that.
Un minuto, tenemos que mover. Vale. Va a haber luego otra sesión sobre desarrollo y aprendizaje.
No, mi pregunta es muy rápida. Si tienes dos resonancias bien, ¿tendrías que seguir repitiendo resonancias? En cuanto a formación de venas de la cabeza.
If you have a good MRI and you have another one after a couple of years, 2 or 3 years, maybe we can tell if you need another one. Because we know if something is happening or is steady or is improving. In Jacobsen, some MRIs were so bad. They were thought to have a metabolic disorder. And after a while, the MRI was better. Okay?
Okay. Well,
una apreciación, Sixto, si me permites. Si un paciente, desde mi punto de vista, que está seguido de manera correcta, tiene al menos 2 resonancias magnéticas de calidad cerebrales separadas en el tiempo, considero que, salvo que haya un cambio clínicamente relevante, no está indicado realizar una tercera. Absolutamente, es que creo que no ha quedado quizás muy claro. Es decir, no creo que tenga ninguna utilidad práctica hacer resonancias magnéticas seriadas a un paciente que no presenta alteraciones clínicas relevantes. Con 2, una que normalmente se hace de lactante y una cuando ha terminado el periodo de mielinización, es más que suficiente.
If there is something in the clinical
Si hay algo raro,
in the resonance,
eso es diferente. Si son normales, no hay que seguir. Bien separadas en el tiempo, porque si no, no tiene sentido.
Gracias por la matización. We have to leave it at this now.